Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Hypnosis. We're finally going to talk about hypnosis. Also referred to as hypnotherapy or hypnotic suggestion. And supposedly, it's this trance-like state in which you have this heightened focus and concentration. And did you know that hypnosis can be used to help you gain control over undesired behaviors or help you cope better with anxiety or pain? So if there's anything about me you'd like to change, Tracy, today may be your chance.
I just so happen to have a handy-dandy list right
I
here.
bet you do.
But
one at a time.
Yeah, the experts say even though you're more open to suggestion during hypnosis, you don't lose control over your behavior. Some of those stories you read about people who are hypnotized just aren't true.
Well, I hope not. That's some crazy stuff out there, isn't there?
Here to discuss the use of hypnosis in the clinical setting is Debbie Fuehrer. Is that correct?
That's correct.
Sorry.
All right, we want to know.
Hold on. I did it. I said it wrong. Here to discuss the use of hypnosis in the clinical setting is Debbie Fuehrer, a counselor with the Integrative Medicine and Health Program at Mayo Clinic. Welcome to the program, Debbie.
Thank you.
Hey, Debbie, so nice to see you. We all want to know this. I mean, it's such a terribly interesting, potentially entertaining story. But the first question is, we'd all like to be able to hypnotize somebody. How did you learn how to do it?
My training in graduate school was to take 3 different classes on hypnosis and then to practice, because you learn the more that you practice it. You can see that different techniques work with different people. But the important thing is to empower people to bring their suggestions to you, and you're guiding them with their own suggestions. So they don't lose control. It's not a form of sleep. It's not that only gullible, weak people are hypnotized. As a matter of fact, most of the population can be hypnotized, and you can see that. Just look at the recent Super Bowl, when people were like focused attention, ignoring peripheral information, and then they're just totally unaware of anything else as they're focusing on the game.
Or Lady Gaga, one of the two.
That even more.
So can you tell if you were hypnotizing someone, can you tell when they're hypnotized and when they're not?
I ask them. I will just simply say, let's say I'm giving them a suggestion to have, to become more relaxed, and I will have little markers where I'll say, you might already notice that your fingertips are getting warmer. And, I'm going along with whatever their response is correct. So they may say, no, I don't notice it yet. And I'll say, well, let's just continue with that. And as you relax more, you might see that the warmth is moving up your hands. And then they'll go, yeah, I'm starting to feel that. And so I would never argue with them like, yeah, you're just faking. If they say, yes, I can feel that warmth moving up my body, and it's I do it in conjunction with other techniques like progressive muscle relaxation or cognitive behavioral therapy. It's stronger if you do it in connection with another technique.
How is this different than what a lot of people know about hypnosis as they see in a nightclub act or on the college campus circuit? That's a group of people usually. So what are you doing differently?
I'm using suggestions to help them make changes in their behavior or cognition or sensation or perception or their mood in a way to help them feel better. In a nightclub act, they're doing this for entertainment, and they're very, very good at choosing who can be hypnotized easily. And then the person who's doing it, they know what they're doing, and they're totally okay with entertaining.
So tell us how you use this in the clinical setting.
So I personally like to use it to reduce pain, to reduce anxiety, to help people. For example, if you want a more concrete example, I have a patient who's going through proton beam therapy, and she has to put a mask on. And she felt that this was very restrictive, and it's scary, and you can't move during this whole time, so you get claustrophobic.
Sure.
So then I practice with her before she goes to proton beam again. And my goal is for it to get boring. I know I'm not going to tell her you're going to enjoy this, but if it can just be, it's
So
no
that
big deal.
so that it's not anxiety inducing.
Exactly.
What about smoking? Can you help people stop smoking?
If that's what they want to do. So I can never make anyone do something they don't want to do. But if they want to quit smoking or lose weight, what I suggest they do is they come up with their own suggestions, and then I use those suggestions to guide them to make those changes, because it's an agreement between the two of us that I'm going to use psychotherapeutic technique to help you make these changes. So sometimes I might start with harm reduction. I'll have them reduce the amount that they're smoking or reduce where they're doing it.
And what about weight loss? I mean, it seems like if this actually worked, you'd be pretty busy.
How effective is it?
Again, I think it depends on the individual. So it's important that the suggestion be positive and current and here and now. So, for example, let's say Tracy said, I love chocolate and I want to reduce the amount of chocolate I eat. And I did bring you some chocolate just in case. And I would say,
You got to share.
Okay.
when you unwrap this wrapper, I want you to just smell it and then take the smallest bite, and you will notice it just floods your mouth with sensation and chocolate, and you really enjoy the whole experience. But it's so intense that I don't think you want another one.
Wow.
Well, interesting.
And
Well,
that
I
works.
do. I already know I want another one.
I like the idea, this list of, and I'm in my show prep to speak with you, it says fatigue. How do you use hypnosis to help someone with fatigue?
Right now, I'm participating in a study as a hypnotherapist to see if we can help breast cancer patients who are going through radiotherapy. And we're doing two things. We want to reduce the fatigue, and we also want to reduce the emotional distress. If we can just suggest to them in a more positive, current way as you feel energized, not you don't feel as fatigued. You know, you feel energized the next time that you will go through this radiotherapy. And then we also talk about the emotional distress, because we're working on both of those.
Are there any risks here? I mean, have you ever said to yourself, ooh, I went a little too far with this one. I'm not sure we'll ever get her back.
It's not possible to get stuck in hypnosis. You physically, emotionally, you cannot. It's like saying you're getting stuck reading a book.
Sure.
You know. Now, I am careful with, if I have someone with severe mental illness, I may not choose to do hypnosis.
Sure.
And how do you know finally, because we're on 150 radio stations, so not everybody's going to be able to come and see you, but how do you know how to find someone who is a good hypnotherapist?
I strongly suggest that they find someone who's licensed in psychological services, and that they also don't be afraid to ask. How much training have you had? How much experience have you had? When have you used this? And I would also be careful that you not go to someone just because they put that shingle out. You know, you really want to make sure that they're educated and licensed.
All right, I think my fingertips are starting to get a little warm.
She has that effect on people.
That's right. Mind-body specialist Debbie Fuehrer. Mind-body specialist Debbie Fuehrer. Thanks so much for being with us.
You're welcome.